Good morning. Good morning, Caitlin and Denise. Welcome.
Good morning, Leanne.
Thank you
Good
so much,
morning.
Denise. Thank you so much for always being so supportive of us. Caitlin, I don't think we've had a chance to meet, but just on LinkedIn. Would you like to say a little bit about yourself and why you're here? I'm going to have everybody, when everybody gets in here, go to the chat and put their name and phone number and email and stuff in there. And then it tells some of the things that you can do that's, if you're interested in this project, basically, what you might be able to contribute. So tell us about yourself.
Gotcha. Been a nurse for about 25 years and started neonatal pediatric ICU. Now finished the last few years working in hospice, so done the gambit. And along the way, have definitely identified a lot of the issues in healthcare right along with everybody else, and am looking for a path forward at this point, career-wise, as I'm transitioning to see if I can't find a way to make more positive change. I am a national conference speaker as well, and I speak on the science of compassion, trying to help nursing and healthcare professions to both utilize self-compassion, but also compassion in leadership and teams.
I just spoke on, let's see, I mix up my days. Thursday, I guess it was, I talked to Dr. Bob Dent. Do you know him? He he's been a CNO at many different troubled hospitals and turned them around. He's now become a coach for leaders who are in hospitals and trying to figure out what do I do with this situation. And he's probably one of the most wonderful human beings that I know. And so that was very encouraging to me to see what he did to bring, compassion and caring to nurses, to all of the employees, especially during COVID, and really bring, a troubled time, bring people together in a troubled time to work together. Um, I just have a lot of respect for him. And then yesterday I spoke with Darlene Kuna,
Yep.
CUNHA, you know her.
Yep.
She's wonderful, absolutely wonderful. I knew that she was with Caritas, but or uses Caritas in her work, but I didn't know, more of the specifics of it. I'm kind of trying to watch here to see if there's any more people in the waiting room. It looks like there are a couple. So Liz or Denise, maybe you want to talk a little bit with Caitlin as I do
Certainly.
this.
Good
I'm also
morning.
trying to check my phone to make sure people aren't trying to get in.
Caitlin, do you know Pontia Vahidi?
Yes.
Oh, good, good. If you did not, I was going to say you need to meet her. She's fantastic. Good, good. Well, good
Yeah,
morning.
I'm in a loving organization as a charter
Oh,
member
you
with
are.
Centia. Yeah, and then I ran into her actually while I was speaking at a patient experience conference out in San Diego last year.
Okay, great.
So we were
You
able to
know,
meet in person.
what is the a loving organization doing? Because I not
Good
seen
morning.
what they're
Can you hear
doing.
me? Because
Are
I
they
can't hear you.
Yes, we can hear you.
Okay.
I was thinking you had this problem last time,
You
did
know
you?
what? I'm going to come back. Sorry.
Okay. All right. Thank you.
And a living organization at the moment is gathering just a lot of global thought leaders. I think a lot of the same ideas in terms of what nurses transforming healthcare are working on, which is one of the reasons I dropped in today, is they're pulling together as many of the global activists around healthcare innovation and improving the system to move from more of a currently defined as fear-driven leadership system to one that is a love-based leadership system, and kind of returning that humanity aspect into healthcare again. As the how, it's a work in progress. They're kind of in their infancy. They're mostly in the phase where they're still gathering people together, creating definitions, but I think they're striving to do more research review, white papers, things along that build that more solid argument for both what and how to create that compassion-based leadership and system processing in healthcare. And I know that if anyone's interested, they would welcome inquiries from anybody in this group, and Pantee is a part of that.
Well, that's what we're doing.
I
Right.
know.
Do you know Kathleen Bartholomew?
Oh, yeah.
We talked
Yeah.
last week.
Oh,
Yes.
okay, wonderful. Okay, great. Oh, yeah, that's why you had asked me if I had the connection for her. Yeah, great. Okay, I am still admitting. I'm wondering, Kathleen, could you kind of lead the people that are here? And I'm continuing to bring people in. And I don't want to miss anybody on my phone either.
Sure. Well, big welcome to all of you. Thank you for joining us. This is an informal meeting that we have once a month on the second Saturday of every month to gather together to answer questions about what we're doing, to learn more about you, to discuss the state of healthcare. And so I know everybody on here except for how do you say it?
Iomides. He was actually here
Iomides?
last week.
Okay, I
Yeah.
don't know who he is.
Right.
So-
Or maybe I'm not right about that. Maybe you are new. Iomida, can you come on and just tell us who you are and where you're from?
Yeah, thank you very much. I am Oluboye Ayomide, from Nigeria. So I was invited to the meeting by Adebanjo Joshua.
Yes, that's who I was thinking of.
Thank you.
Wonderful. So you're in Nigeria right now.
And you're a nurse also?
Sorry?
Are you a nurse also?
Yes, yes.
Yes, wonderful.
I'm in
It said he was
Nigeria.
bringing a friend, so I didn't know who it was going to be. He didn't tell me the name, so
Wonderful.
wonderful. Thank you.
How about some brief introductions?
Before you go there, I want to just mention to everybody that I would like you to go to the chat at some time during the hour and put in your name, your email and phone number. There's also some suggestions there if you're interested in what we're doing of what you can do. There's a link there called the NTH interest form, which will both tell you a lot of information about what we are now doing going forward. We've just done a complete reorganization, and we're ready to start inputting the people who want to do the work. So if you're that person, and if you're not, if you know somebody else you think would be, please ask them to connect with us. So that's enough for me. I'm still adding people here.
Okay, we'll start with who everybody is, and then we'll say a little bit about that recap for Nurses Transforming Healthcare. Does that sound good?
Yes.
Okay. Judy? You're on mute.
Sorry.
Welcome.
Yeah, thank you. I wanted to see what this was about because we've talked a lot on HRC, and it sounded like you guys were really trying to make progress.
We are. Thank you. Where are you calling us from?
I'm calling from Minnesota,
Oh, where in
um,
Minnesota?
Eden Prairie, down by Minneapolis.
Okay, I'm in White Bear Lake.
Oh, you're kidding me.
Yeah.
Okay.
That's where I
Well,
am.
I know Don was the only one I knew from HRC that was in Minnesota, but no, I'm semi-retired. I am the founder of Lakeview Ranch Model of Specialized Dementia Care, but that was in 1999. And I quit my job in sales and built a rural residential home with a barn and 35 miniature farm animals, and hired some 4 RNs who were willing to go against the system. And it was all a memorial to my mom, who had vascular dementia and for 7 years was in and out of memory care and in hospitals for her behavior every other month, and eventually just drugged into compliance. They told me that was the
Look
only.
at you.
Yeah,
You bucked the system way early.
Yeah, and I couldn't have done it alone, but I couldn't get any people in the system that wouldn't tell me I was just crazy and a family member in denial. I didn't realize that my mom had dementia, which I knew, but that they kept saying she wasn't in there anymore. So when I asked for her emotional needs to be met, they just said they don't have the staffing to do that. And even 7 years later, when I won the Robert Wood Johnson Award, a family member, put us in for that award after they saw what we were doing. We took away the psychotropic drugs, number one. That's why I had 4 RNs. We had to be very careful titrating them back. And we didn't know what was going to happen, but we were willing to take that risk. And
I'm
my
afraid I'm
son,
gonna have to break in, Judy. Maybe
Yeah.
you and I can talk separately too, since we're in
That's fine.
Minnesota. But we have a lot of people on today and I
Oh,
want to
okay. I
everybody, if you
wasn't
can.
sure who was here.
Yeah, we didn't
Okay.
really tell you how to
Sorry
do
about
this. So
that.
if you can, just say
Yeah.
your name, where you're from, why you're here today, that would be
Okay.
fantastic.
Yeah,
So each person.
okay.
Liz, are you next?
Hi, I'm Liz Weiner. I'm in Huntington Beach, California. I'm a body talk practitioner, so I'm, very interested in the wellness component of Nurses Transforming Healthcare program.
Excellent, thank you. Kathleen, take it back again.
I'm Kathleen Bartholomew, one of the founding board members. We have 3 board members here today, or current, Sarah and Leanne and myself. And I worked trying to improve the culture of healthcare and patient safety for 25 years until I realized that was futile. Donna Bedian says that structure dictates process, which dictates outcomes. If you want to change the outcomes, you need a new structure. And Judy just demonstrated that when she talked. She told us about the new structure that she created. So that's me, and I'm all excited about you all being here.
Yes, wonderful. Keep going. Kathleen, can you call people out? I'm still
Sure.
watching phone and
Yeah,
my.
sure. Joshua, where are you calling from?
Good day. Hi, can you hear me?
Yes,
Okay, I'm Joshua Adebanjo, and I'm calling from Nigeria. And this is my second time in the meeting.
yes.
So, and I invited a friend along, so I'll be introducing him. So maybe the next person, that's
Yeah, he
Oluboye
is on.
Femi.
He is on. He has come in.
Okay. So
Okay.
thank you very much.
And you're a nurse. I'm trying to think, were you an obstetric nurse? I've forgotten
I
what
was
your background
registered
is.
now, public health and the midwifery
Public.
with
Public
bachelor's
health.
of nursing.
Thank you.
Yes. Thank you very much.
Caitlin, did you?
I did a bit at the beginning, but yes, my name is Caitlin, author and founder of Beauty After Breast Cancer, which is an outreach organization, conference speaker on the science of compassion, helping to support healthcare providers to understand the science of stress and to build foundations on better communication science using trauma and cognitive theories and studies.
And your book is called?
Beauty After Breast Cancer.
Love it. Karen? Where are you calling us from?
Hi, can you guys hear me?
Yes.
Yep, hear and see.
Okay. Hi, I'm Karen O'Donnell. I'm calling from New Hampshire, and I am an emergency room nurse. And I stepped a little bit away from the bedside and became an entrepreneur, creating a staffing agency. And I recently started a business on health and wellness, and looking to help people prevent illness and heal their bodies before they have diseases.
Wonderful. We'll have to put you in touch with Kim Evans, who has her own integrative practice.
Excellent. Thank you.
Luke? You hear us, Luke? Okay,
Yeah.
Denise?
Good morning,
Good
Denise
morning.
Wiseman.
Well, that's a deep
Uh,
voice, Denise.
I am trying to get over a cold.
Oh,
Uh,
I hope you feel better.
calling you, thank you. Calling you this morning from Auckland, New Zealand, but I typically reside in Washington State. And it is Sunday morning, 4 a.m.-ish here in
Oh,
Auckland.
Oh, Denise.
thank you.
Yeah.
Wow.
And I'm one of the co-founders of the Healthcare Reinvention Collaborative. And what we seek to do is to identify, connect, support, and illuminate change makers, ruckus makers, all of these individuals on the phone today. And of course, we're very much in support of NTH.
Yes, thank you.
Appreciate that. And finally, Sarah.
Oh, I think we didn't get
Well, was
Joshua's
waiting for
friend.
Luke.
Oh, okay, but and then Joshua's friend also. I guess we did talk.
Yeah, we
to
did.
Free-
Yeah, we did.
Yeah,
Mhm.
we did. Okay.
Good morning. My name is Sarah. I have been with NTH for a couple of years now. And I have worked in the medical field, but currently don't. But that's what I love about this group. As as our group evolves, so does the disciplines that everyone comes together to help kind of bring the needs that we have for healthcare improvement, and it takes all types and all kinds and all backgrounds. So just I love the fact that we have such a dynamic, diverse group that comes together at these conversations and every month, and that are involved in our board, involved with our various committees. If you're interested in getting more involved, and after today, you might have to scroll up a little bit on the chat, but I did put a link to our interest form. So if you are thinking like, oh, I'd like to help or I'd like to learn more, definitely feel free to fill that out. And myself and Jennifer Beach, who is also on the board as well, we will reach out to you. But other than that, thank you so much for being here today. We're thrilled to have you.
Wonderful.
Yeah.
Thank you, Sarah, for all you do. I appreciate you. Okay, so I'm not seeing too many people adding yet. There may be a few more that come in. I'll try and keep watch. Sarah, can you see the people trying to get on? No?
If you want to make me a co-host, I can keep an eye on that for you. Not a problem.
Okay. So Kathleen, you told a little bit about yourself. I guess I will, I don't know how to do that, I guess. Anyway, I will just kind of keep going here and kind of keep an eye on who might be coming.
Leanne Meyer
What?
from Minnesota. One of
Yes,
the
Leanne
founding
from
board members
Minnesota.
who's keeping an eye on the other guests. And Leanne, next month, what we have learned is that we'll have somebody else do that so that you can focus
Yeah,
on
I think that's probably a
hosting.
good idea.
Okay?
Okay.
All right.
At any rate, I was one of the co-founders, Kathleen, myself, John Silver had said he was going to do his best to come on. He is the one that created the adapted public utility model, which is what I think makes all of this so different from any other people that are talking about transforming healthcare right now. Most of the people or most of the ideas that we've heard have been about basically trying to work within the system that we already have and we know is collapsing. So to me, that seems like having moving chairs on the Titanic. It seems like something you can do right now, but it doesn't really accomplish anything and nothing for the future. So that's why the four of, and then Kim Evans is the other person that Kathleen mentioned, who is the other co-founder, and she has had her own integrative medicine clinic for 25 years or so. And so she has been invaluable between John's adapted public utility model where we could actually get away from the system we have now, the structure we have, the system we have. And it would be something that would join under public health, which has been decimated over the last 30 years, and something that could be rebuilt. But what John always points out is that the public health has a structure already in place across the country that we could utilize to create regions that would be responsible for the areas right around them to help keep people healthy, to make sure they're getting their needs met. And that would include the rural areas around them, not just the urban areas, which seems to be what's happening.
There's currently no incentive for wellness and prevention, which many of you have expressed that you're passionate about.
Correct.
So the incentive, you know, I always tell the story of meeting with a CFO who showed me a 350 bed hospital. And then I asked him where people worked in his town. And he told me that everybody worked at the hospital. They were the major employer in town. And I said, well, what are you going to do when you keep the town healthy and the beds are empty? And he looked at me and said, I'm sorry, I don't understand the question. Because there is no plan for that. That's little story demonstrates how our system is designed, okay? And if you'd like to learn more about the adapted public utility model, we have a wonderful little Q&A of John and one of our members talking that we can send to you. That's the best way that you could learn more about it because it's just a little video. And, you know, the Loving organization, we're so aligned with what they're doing too. What we want to measure and care about is compassion, connection, community, and caring. You know, I mean, these are the things that we're focused on. We learned from our pilot study a couple of years ago in Spicewood, Texas, that if you're going to create a new system, you need different sets of measurements. So what do you want to measure in this new system? Well, what you want to measure depends on what you value. And we're not valuing efficiency and productivity, we're valuing the relationship. I don't know if you saw that yesterday China opened up its first completely robotic hospital with all doctors and nurses are robots. Okay, and that was yesterday. So I think this movement is more than just about health and healthcare. I personally believe it's about preserving what it means to be human, preserving our humanity, our interactions, and we can't do that until we reclaim that sacred relationship that a healing person, whether a pharmacist, a physical therapist, regardless of the role, has with their patient. I never did like the word client. Do you all remember a couple years ago when they tried to call everybody customers? Do you remember that?
Oh, yeah.
There's still
Very
an
well.
active group that argues for that, Kathleen,
Oh,
that
sad.
patients, yeah.
Sad. So what questions might you have? Very quickly, if you can imagine water and sewer and electricity, which are our public utilities, like health is also a public utility. You can't flood water into a town without having a structure. You need the reservoir, you need the pipes. So that's what I've promised you a recap, and what we've done in the last 3 months is draft a white paper and a manual called Flip Your Zip on how you could flip one zip code in America from sick to well and from a business to a service. In order to do that, we need financial freedom. And we need everybody's voices, lots of eyes on our playbook.
I just put up the link to the video with John and Roberta Brofman. That it was an interview question and answer. So if you want to copy that, that would be something that you could certainly look at later. It's about 30 minutes.
Thank you, Leanne. Thank you.
So I know I've talked to some of you, you've had lots of ideas. Luke, were you ever able to get back on here and tell us about yourself and if you have any questions? If not, I think I'll just give you a little bit of history here. So this group started essentially with me because of an international talk show for nurses that I had starting in 2017. And my goal was to be able to give nurses a voice, a platform for nurses to be able to speak, because we have been just silenced forever. And so that was the plan. In the meantime, in 2018, I was able to interview John Silver, who was amazing with what he had come up with. He started as a respiratory therapist, decided he really liked what nurses were doing, so he became an AD nurse and then a BSN, an MSN. And then he asked two questions of himself and everybody else he could talk to. And that was, why is healthcare so messed up? And why do nurses are not in charge of their own profession? And so those were the two questions that started him on the way to a PhD, which he wanted to see if there was any other economic way or, another way of dealing with, sorry, I've got a storm going on outside. It just distracted me. He wanted to know if there was any other way than how we're doing it, which is clearly not working. And so he spent time going to different countries to look at different economic models, ended up coming back to the United States and saying nothing he saw was going to work. And so he started looking in the United States, and he came across an old project that was done in the 1930s, because at that time electricity was not getting out to rural areas or to farms, and it was because it was too expensive. So the people who were selling electricity were happy to bring it to the cities, but not happy to bring it to the rural areas. And so a rural Electric Association, REA, was created in the 30s. My grandfather was a beneficiary of that on his farm. And that was, it was called a public utility model. And I think Kathleen alluded to this earlier. If you have sewer and water and maybe even electricity, that you have a bill, you pay a small amount for those things, but you do not pay the total amount for, even maybe for your own family. But what it is everyone is contributing. So your community is contributing, your county, your state, the national is having a control over that so that it cannot be monopolized, and therefore putting most people into a difficult situation. That's what we think needs to happen with healthcare also, that it needs to be a service, that it needs to be
Local.
local. It needs to, and I talked briefly about under the public health service, we would have regions that are already set up, but we could set them up even more defined so that each teaching hospital or university that has research would be able to be the people that are in charge of the area around them, whatever, area that would be, including rural and underserved urban areas. They would be responsible. And the whole idea is that you would be reimbursed based on your collaboration with people in your group, with people across the country. You would share, not sell things to different people. As you've learned something that is fantastic, instead of taking 10 years for something to come from research to actively being used.
It's 17 years now.
Oh, I'm sorry, 17 years. I'm way behind the time. So at any rate, that it could come out more quickly and be utilized by more people. And then as people in different areas find that, oh, this is, something that is more specific to our area, and you may also have citizens that have this problem, that you could add this to whatever else. So reimbursement would come based on good outcomes and that basically means keeping your people well. And keeping people not sick. I mean, really keeping them well and keeping them prepared for anything that's coming, catching things before they become a problem.
And not only would they be motivated, but they would be responsible because they would see and could see easily. For example, if you had one zip code, that the healthier, you would create a report card for the zip code so they could see every 6 months the health of the zip code. And as people got healthier, you would save money, and that money is given right back to the zip code so that they can invest in whatever they need, because healthcare should be local. Every zip code has a different need. And so this all encourages creativity,
Sorry,
encourages.
sorry for coming in. I want to ask a question.
I'm sorry, Joshua, could you say that again?
Okay, I wanted to ask a question.
Yes.
I wanted to ask, for we in Nigeria, I'm still trying to get people to talk to people I trust and speak with them about the program. I wanted to ask, what are the plans? Is the program only for the United States alone, or are you planning on going outside the United States?
We're not planning on going outside the United States, but we certainly are planning on sharing our work with anybody so that they can repeat it. Our goal is to find one zip code where we can trial the model, and then it has to be sustainable and replicable. And so then we would let anybody who wanted to use it, because the research shows that how you change a very complex system is to stand up in one part of the system, a new system. Exactly what you want. Are you familiar with the Costa Rica model, Joshua?
All right.
Yes?
So, wait, what? Wait, what?
The Costa Rica model. The Costa Rica
I can't
model?
hear you. Can you hear me?
Yeah.
No. I just finished school. The models I use are for basic research, like the Earth Belief model. I'm still a young nurse, so I'm not really into all these models yet. So I do mostly Earth journalism and computer. Currently, I'm the Chief Technical Officer for the Forum for Shared Governance in the United States of America. You might have heard about it. Forum for Shared Governance.
Joshua, can I ask you to talk a little slower? We're catching, but the words kind of go together, so it's a little hard for
Okay.
us to hear it all.
Okay.
Thank you.
I said I don't really know about the models, like the models she's talking about. The models I know are for my research. The ones I use for my research as an undergraduate, the Earth Belief model, those are clinical models, like for clinical research.
Right.
And but I'm trying to say what I do. I'm into Forum for Shared Governance in nursing. Shared governance in nursing. So I work
Shared
with
governance.
yes, for nursing. So I work with the Forum for Shared Governance in the United States, with Robert S., a fellow of American Nursing Academy. So I'm trying to know how I can help and my involvement in this program. So I'll be able to know the role I have to play, and I will not have to take a long time and stuff like that. Thank you very much.
You're welcome. We'll be sharing that rollout shortly, and you are more than welcome to use it, right? Right, Sarah? It means, yeah, you're more than welcome to use it. But one of the key things that we found, which I'm sure, Joshua, you already know, and that is that you partner with the community and really you support the community, and you get all the stakeholders together. One example in Spicewood, Texas, where we went, was we wanted to do a study of the zip code, and the participants, the people who live there, said, we don't like to be studied. We don't like that. And so I said, well, how are we going to get the information? And they replied, you can call it a survey. And I'm like, okay. So like, it might be a very simple thing, but it's very important. And then they are the ones that named the survey, not us. So many times, especially in America, more so than other countries, it's top down and hierarchical. And this is a totally different power model where the most important thing is the health of each individual. And we're all in a circle around that person, cheering them on, doing what we can, and answering what they need.
And what you said, yes, I understand that for any research, even here in Nigeria, before we can carry out any research, we go through the ethical review committee, and then you have the consent form. I understand that aspect. But what I'm trying to say is we have a lot of programs too. And I really want to key into this. I'm a public health nurse, registered public health nurse with the Nursing and Midwifery Council of Nigeria. So I want to know, like, yes, I spoke with Linemia. I can't really pronounce her name properly.
Leanne.
Yes, Linemia, and I wanted to go into to work with you, like to volunteer my services through web development and okay, shared governance is a great step. Okay.
And Sarah is the
Okay,
person that you need to talk to about that. I did send on to her the message you sent me. So Sarah is on this
okay.
call. Did you put your, I can't tell if you put your email and, probably she could go through LinkedIn also, but, if you can give her your email, she can connect with you. And if you fill out, better yet would be if you fill out the interest form, which would give her a better idea of what you're bringing to the table and where you see yourself being best able to help.
So we're
Okay.
not sure if this idea is makes sense to all of you. We've been doing it for 4 years now and pursuing it and developing it and, you know, finding out how we can create a model that's really focused on wellness. And as Liz mentioned, she has one of the alternative
I can barely
modalities.
hear you. I think the network is breaking. Can you hear
I'm
me?
sorry. What did you say?
I think network was breaking a little bit.
Yes.
It's breaking
I
up.
think your network
Yes.
broke a little bit at some point.
Yes, it's
Yes, at some
hard to
point.
hear you too, Joshua. It's been,
All
yeah,
right.
so maybe we can have a call offline, like we'll
Yes.
we'll call afterwards with Leanne or
I can't, I have to leave right away.
well,
but
that doesn't have to be
yeah,
today.
yeah, another day we could set up, that would be great. You also mentioned having, you know, the nurses come together. I forget the word that you used, but collaborate together. We also feel that this is a reason why nurses have not been seen, not been heard, and people do not realize what we do and how much we add to the healing of the patients that are under our care. We're still thought of as handmaidens to the doctors, and that is such an old thing. I mean, I've been a nurse for 50 years and it really wasn't true then. So, you know, so much has happened with the training, the education of nurses since then. We are able to do amazing things. Kathleen, if you want to tell a little bit about Spicewood and how that started, and people said, yeah, but what can nurses do?
Well, yes, a lot of people here know. So really quickly, we put a nurse and a nurse practitioner into a food bank. The food bank was open 1 day a week. And the nurse practitioner wrote a care plan for 41 patients. And she assessed, the first thing she assessed was the social determinants of health. And we also saw the urgency. So the nurse then had 3 months to follow up and to meet the goals of the care plan. But the care plan was created with the client. So they created it together and they prioritized it together, because sometimes the first thing was housing or a job or pain, etc. It was different for everyone. And what I loved was that the care was unique, it was specialized, it was non-judgmental. Actually, Caitlin, are you really active in the Loving organization? I don't know if you're still there, but
Sorry, searching for my mute button. Reasonably, yes.
recently, yeah, we would, you know, I don't understand why there's 2 organizations doing the same thing. I mean, ours is yeah, so perhaps we should talk more, or maybe there's somebody I should talk to there more.
I can help hook you up with partnership kind of concepts, because I think there's definitely 2 different angles, but it's absolutely heading for the same goal.
Right. And so, you know, I just reviewed an email I sent yesterday. Somebody told me they were very happy. They started a new nursing organization, and I was so depressed. And so I waited a couple days and then sent them a letter saying, like, I'm happy. I can see your energy and I know you're excited, but I was really depressed when I read your email because after my AI search, we now have 255 major organizations instead of 254 from yesterday. And we can't keep forming new organizations. In fact, we're happy to merge into any other organization because the most important thing is the goal. And what's against us, our greatest challenge actually is not the healthcare system. It's nursing. It's the fact that our leaders do not talk to each other and we have no unity. We're not a united front. So until the AONL, the ANA, AONE, etc., NLN, everybody, these leaders form a coalition and start talking to each other, there's really, we'll continue to be an oppressed group because that's what oppressed groups do. They fragment and they all work really hard for their own viability rather than coming together. And that's why I like HRC, Denise's organization, because it's focused on networking. And when you join one of their calls, and if you're on a call, they break into groups and you can have individual conversations and you learn. How do you do that, Denise? You learn more about what other people are doing. I had no idea I can think of a half a dozen people off the top of my head. So you've got many people in the United States doing innovative and interesting work. The question is, how can we put ourselves together and demonstrate in one zip code why focusing on you can just say doing the right thing. Doing the right thing. Why can't we do that in one zip code? Be a loving organization, be, for nurses, recognize that the patients will only be as healthy as the caregivers. Be innovative and listen like Judy did and not drug the patients and have a belief system that values each human.
Yeah.
And this was demonstrated, I think, for me, by Candace, who was the nurse practitioner in Spicewood, when a woman who was clearly a drug addict came in and with no judgment at all, Candace listened to her story and found out that her neck was in excruciating pain and she had finally started taking anything she could off the streets for the pain. So she wrote a script and we gave money for one appointment for $50 to a neurochiropractor right there in that village, right there in that town. And as soon as he took an x-ray, he donated 9 more sessions. Her neck was so out of whack, the pain had to be excruciating and she needed traction. And 2 months later, I returned to Spicewood and she is happy working in a job, drug-free, tells me she saved up $1,000 to get the transmission on her car fixed. She looks like a totally different person. Why? Because someone heard her story. I mean, I was just doing some statistics for I didn't know what medical gaslighting was, but I just found out in a recent study, 94% of patients said their symptoms were ignored. And 61% said once they said their symptoms, they were blamed for them or they were invalidated. All right. So, no surprise to any of you, right? I mean, look at Caitlin and her motivation when she shows you pictures. I mean, it's traumatic to have breast surgery, to have breast cancer. It's traumatic. And they cut off the heads of everybody in the picture. So it's like only a portion of a human being, not the whole human being. So what does she do? She goes out and writes a book and has tons of pictures that have the whole person, right? You don't have to tell healthcare professionals what the right thing is to do. Right?
Yeah.
We know what it is. But what people don't see is that it's the system. It's set up as a business. So you can make all the rah-rah nursing organizations you want, but it's not going to change the system. Our biggest problem isn't the system, it's getting our leaders to come together and recognize, for example, that you should not partner with the AHA, the American Hospital Association. You have been partnering our nurse leaders, our chief nursing officers all over the country. Structure dictates process, which dictates outcomes. Our chief nurses all over the country partner with the American Hospital Association. And when you ask why, they say, we believe in partnership. And my response is, I do too. But if I'm going east, which is keeping people out of a hospital, I'm not going to partner with people who are going west, whose goal is to keep as many people in the hospital as possible and maximize revenue. So I always talk about the lollipop factory. A lollipop factory makes lollipops. I don't care what you do to the conveyor belt. You can change the color of the lollipop, the cellophane, the length of the popsicle, the flavor, but it's still going to make lollipops. Our healthcare system is working perfectly. It was designed to make sick people, and every year people get sicker and sicker. Our length of lifespan is decreasing. Our obesity nationwide is off the charts. Diabetes, off the charts. Almost half of the nation suffering from one of the top 5 chronic diseases. And all that for 19%, what is it? 19% of the GDP. Trillions of dollars because it's a business. Okay, so let's create something that's not a business, where you don't have to charge for every Band-Aid and every word spoken. There is no billing code for all of the things that we do. An example would be when a person who had quit smoking for 62 years in the food bank, 62 years this person had been a smoker, a pack a day. When the nurse counseled him and got him into an organization and he stopped smoking, he came to her and said, I always wanted to write my story. And they say when you stop doing something, you should start doing something else. She goes to Barnes & Noble and buys him a journal and a set of pens. What's the billing code for that? Okay, so one thing that I did see is the power of caring and nursing and loving and healing released. When there were no constraints, every need was answered. And that is exciting and hopeful.
I'm wondering, Luke, you had said okay at some point. I'm wondering if you are available to tell us who you are now. Luke Adams. I'm not sure if you're able to unmute.
We'll ask you to come on if you can,
yeah.
and when you can.
When you can, just unmute and we'll notice you and get you on. So
anyway, is that articulate or is that, does anybody have any questions about that?
Kathleen, you said a really scary statistic that really resonated with me, and it's about the blaming of the patient. And I think that's something that is accurate, and it is something that we should, as not just as healthcare professionals, but as just human beings. Why are we making that okay? Why is that the culture? And how is it that can be incorporated as part of the alternative model of creating a holistic approach? Why is it? I'm just curious. I mean,
why did that belief system start?
Yeah,
as somebody, because I can answer that. In Victoria, you have to go back hundreds of years, but if you were sick, it's your fault.
Yeah.
If you're sick, then you've not done something right. That you didn't take care of yourself, or actually, if you go back far enough, it's a deficit in character.
Yeah, or you sinned, or
God's punishing you.
God is punishing you.
Yes.
And so some of that
Okay.
has come forward, but I think, you know, a lot of the reason why it has changed in the last 30 years or so is this idea of the model changing from being basically service-based to being a corporate entity designed specifically to make a lot of money off of sick people. So then your object, whatever you say your object is to have a lot of sick, chronically ill people who are desperate to get well and will pay anything to be able to do so. And so that's kind of where it comes. I want to just briefly mention too that we do have a zip code that we're working with in New Hampshire. And our president right now of Nurses Transforming Healthcare is Emily Spensky, and she has been working for the University of New Hampshire and teaching nurses. She also works with the person that is teaching in the public health area. That public health person had connected to a small community of 3,000 to 5,000 people. And so they already knew her, they had trust with her. So when we decided we were going to do what we call flip the zip, take a zip code and see what we can do with it. So a year ago, I think it was the nursing students, the NPs, went out to this community and did an assessment. I think Joshua was talking about this with the community, asking them what they saw as the major needs in that community. And we were using basically Caritas, Jean Watson's part of her assessment, part of our assessment, and we ran it by her to see if she was, you know, in agreement with it. So that assessment went out and was done in that community. So then in the spring, the nurses then were looking at the data they had gotten, and they were looking at, okay, what is it that we want to go back to this community and say, here's what we learned from you. Here's what we think we can do to help you. And then now starting in the fall in September, I believe it'll be the public health students who will be going out and working with individuals that had indicated they were interested in this project. So we're starting, and in the meantime, they're both collecting data and they're setting up the template so that anybody, you know, potentially anywhere in the world could take this template and go out into a community and do the same thing. And we're not selling it. We're wanting people to be able to, again, you know, here's the idea we have, and you can utilize it.
And how can we make it better also?
And how can we make it better?
Right, yes. So right now we have a great guest from last month, I guess, or last time in the last month, Christina Rodriguez, who has a podcast called Fundable 15, and she's looking at the economics of our model and the fundability of it. So that's exciting right now. So that's something else that we're excited about. And then I'm also excited about putting it up on the HRC platform to get more input from public health, from economists, from physicians, so that it's a very well-rounded approach and that all the stakeholders in health have a voice.
Mm-hmm.
But basically, we're looking for, in a nutshell, a structure, a system. We don't like the lollipop factory. Nope, don't like it.
So we think this is what happened, because there's no way anybody, I don't care how big of a group you get together to say, okay, this is what needs to happen in the United States. There's no way that any group can know all of the issues, all of the things that have been ignored and not dealt with over the past 100 years in the United States. We need to have the input of other people. And I hope not just people, you know, in what we call medicine in the hospitals, et cetera, but I hope it will be chiropractors, it'll be dentists, it will be, you know, people that are doing what we call alternative care now, but often is care that has gone back centuries and millennia. You know, things that have been used until science came in. And yet science is still using some of that stuff, going back to those herbs, going back to some of the things, and only they're putting it into a pharma product and selling it for $1 cajillion. We don't think that is helpful.
Liz,
we,
oh, sorry.
go ahead.
Liz, you've been listening and attending for well over 6 months, maybe even longer than that. What are your thoughts?
I mean, I think this sounds amazing. I mean, the idea is to keep people well. That's what inspires me about it. You know, I was going to ask before, you know, this in New Hampshire or in general, like how are these clinics presented? Is it like if you need help, come in, or if you want to stay well, come in, or is it both? You know, because that's where all of this can serve people, not just when they, you know, these days people wait, you know, you don't go to see the doctor till you're not well. But this is a different framework. So, and then of course, I think that, you know, complementary treatments, modalities, et cetera, can be a big part of keeping people well. And also, yeah, making
I just
them,
had my body talk session yesterday.
yeah, exactly. So, yeah.
Kathleen, do you want to address that? How people are seen?
I was answering Karen's question, so.
Oh, I'm sorry. Okay. So I don't know the specifics of that. I have not been involved in that committee that has been working on that. I'm trying to think. Sarah, do you know more about how the specifics are being handled in New Hampshire?
Oh, it's gone to, Emily's going to give an update on it at the next board meeting because she and April used to take care of it together, and now they both have different jobs.
Okay. All right.
Okay. Yeah, also I saw Sarah posted about connecting to get involved with New Hampshire directly, so I can do that.
Yeah, you
I was
could
going to do that as well.
Yeah, that would be awesome, Liz. What I can tell you is that there is movement going forward with the students. It is gaining a lot of traction, and one of the greatest things that we discovered was that partnership with a local university and a community that's open to trying something new has been highly successful. That we're not going to have answers overnight, obviously, but we are getting the data collected. My understanding is, and again, Emily will be able to share more about this at our next board meeting, and we can share that out at our next forum, which is next month on the 13th. So we hope you can join us. But it's going to be, we are getting information. The students are incorporating that into their curriculum, which I think is groundbreaking. If you can imagine how many people we could possibly just enlighten or touch in some positive way, and just through this process, if we did this at one school, imagine if we had this as curriculum across all universities, what kind of impact that would make. Talk about change making. So we're very excited about that.
And as long as you're using the words, Sarah, imagine, why don't you imagine all nursing organizations coming together as a strong coalition to address the future of nursing?
Right.
Caitlin? Caitlin has just raised her hand.
Yeah, I mentioned in the comments, but I'm in New Hampshire. So
yeah.
Oh, great.
Hook me
It's
up
New
with
Hampshire
whoever your folks are
University.
here. Let me
We'll
see how
hook you up
help.
with Emily.
Yeah.
Yeah. Thank you so much, everybody, for coming. We really appreciate it. And if you have I put my email in the chat, and I'm going to put it down again. If you want to have any follow-up conversations or questions, or I would love it if you'd watch just the short video. It's about 20 minutes, isn't it, Leanne?
It's about 30.
30?
I did put that link in the chat, so you have to scroll back up to find it, but it's an interview with John Silver and Roberta Brofman. And John has said it's the best, most concise thing that he's done. He's done tons of
podcasts.
Interviews and podcasts and etc. But he really feels like this one really cuts to the heart of.
That's because Roberta gave him such a hard time.
There you go. Yep, she did. Yeah, kept him on track. So, yeah, I want to thank you all. Also, if you can come next time, or if you can send other people that you think might be interested, this would be fantastic. And Karen, is it Karen Caitlin? You know, a loving, what is it? A loving organization?
Organization.
You know, is there some way we could talk and
Yeah, I'll
see
work
what
on getting that set up.
yeah, what connections we have, that what could we collaborate on? Wonderful. This has been fantastic. Thank you so much. And we will end now. Some people asked about a transcription. So Sarah, if you have access to that, if you want to send it to me, I can send it to some people. And yeah. So thank you all very much.
Great. Thank you very
Thank
much.
you all. Have a great rest of your day. We'll see you next month.
Bye.
Bye-bye.
Thank you guys. Thank
Thanks.
you for your help and support. I appreciate it.